And when I was working in the department, some researchers came from Kuraray company, and I met them how they prepared the samples, and they were using self-etch adhesive, and they were just preparing samples for research. And the first time I met them, that they were drying the samples with a very gentle air flow, and they were testing it, and they were just uh, drying the primer very slowly and gently. Before I met them, I was using the airflow very harshly, and they said, no, you have to be very careful, and gentle flow is very important during drying the primer. I said, okay, I learned something more. And before I met them, I was using airflow to make the bonding layer thin. Again, that was another mistake, because after we checked our samples by SEM, we noticed with Dr. Inokoshi that when we use not the not the one step bonding agents, but for SE bond. And coming back to Japan again, I was working with Dr. Inokoshi, and I was assisting him in his uh, clinic days. One day a week, on Thursdays, I was helping him. He had many patients, and while we had caries detector in my department before I go to Japan, the first time I see that they are using caries detector very actively. We didn't use. So we had a caries detector, but we didn't use it when I was in my department. But I see that it's very important material, and caries detector came to my life after Japan. You know this very famous paper, Dr. Momoi. She just published a kind of guide how to when to remove red color, how to save it, and of course she concluded at the end that it is very important. Your clinical experience is very important. Don't just follow the colors, and because you know when to remove, how to live, and that's a very good paper, and it guided us for several years. And that time she was the first and only woman professor in Japan, I remember. And I like this very recent paper. It is, I hope you can find and read. It's very nice, like a story. And because of recent situation of the world, everything changing, and after pandemic, the approaches for treatments are changed a lot. So we have to be careful about for a sustainable future. So restoration longevity is important, but tooth longevity is important too. Or that's why maybe we I can say that we started to use personal treatments. Okay, we have some rules. We follow biomimetic dentistry rules, but tooth longevity is important, and sustainability is important, and we have to think about personal treatment techniques for every patient, thinking, considering the patient's needs, and considering the conditions we have and our experiences. And I cannot explain well, but if you read this paper, you will understand better how what I mean. And this is an example. For example, this is a case from our faculty, Department of Periodontology. The patient had some bone loss problem, and she wanted to save her teeth, and the extraction, the implantation, the same teeth was the plan for her. And I was the person who was making ribbon fibers linked to this patient, and 20-year follow-up published very recently. We followed this patient for 20 years, and this is what the patient wanted, and it survived and tooth longevity, and everybody very happy. But this was the very nice case. And coming back to Japan, we had some studies with Dr. Inokoshi, and at that time they were using flat dentin surfaces for bonding studies. And I asked Dr. Inokoshi to use cavities, and because they were not reflecting, flat dentin surfaces were not reflecting the real conditions. And I asked him, may I use cavities? And he accepted. We used slot cavities, and we used flowable resin inside these cavities, and we checked bone strength, and also we had some fracture strength studies. During these studies in SAM samples, we noticed that enamel cracks near the adhesive. For example, if you finish a root canal treatment and restore the tooth, but there is always a possibility to retreatment, he told me that time. And we, of course, we studied coronal leakage with him. And in the history, we know that Marshall and Masseler first reported the coronal leakage, but that time the endodontist didn't care too much about the post-restoration. And Torabinejad found bacterial products in the root field tip after 3 months, and that was a very important result, but still post restoration was not very important. And Saunders first published a paper about coronal leakage as a cause of failure. It is the first very important paper made the endodontists care about leakage. And Ray and Trop finally published a paper in Journal of Endodontics, and they concluded that quality of root filling and coronal restoration, they compared in 1,000 patients, and they said that quality of restoration is more important than quality of root filling in terms of apical lesion.